speakers. We have Zach, Shrem, and Darren Rowland. Zach is the Regional Sales Director in Canada for Strawman Orthodontics, and Darren is the Senior Territory Manager for Western Canada for Strawman Orthodontics, also known as ClearCorrect. So, gentlemen, welcome. Thank you for joining us. Thank you for taking the time and making the effort to be a part of this event. I see you now, Zach. So do you want to share your screen?
Absolutely. Can you hear me okay too?
We can hear you okay. Zach is an MBA graduate from University of Manchester with sales and business leadership experience in 3 continents, including pharma, retail, tech, and dental. So, Zach, I believe you're going to be followed by Darren?
Correct, yeah.
Perfect.
Good morning, everyone.
Pardon me?
Good morning. Sorry, just got on here.
Okay, perfect. Welcome, Darren. So over to you, Zach.
All right, here we go. So thank you, Dr. Nagri, for having us today. We think this is very important. We're really feel privileged to be a part of it. So let us give you a kind of a sneak peek into clear aligner therapy. Let me know if my screen is not seen, just let me know. So we've designed a little bit of a presentation of just to let everybody kind of start thinking about why should we do it? I mean, and there's a lot of elements to it. We'll focus on 2 high-level ones. But before we start, just who we are. So thank you for the introduction. I wouldn't, it's exactly myself, but as to Darren, I'll let you introduce yourself for a quick second. Jump in.
Yes, good morning, everyone. My name is Darren Rowland. I'm Senior Territory Manager for Strawman ClearCorrect in Western Canada. I reside in Victoria, British Columbia. Nice sunny day here. I've been in the clear aligner industry for about orthodontic industry about 20 years, and fixed ortho in the last 15 in clear aligners. We launched Invisalign here in Canada back in late 2003 or 2002, 2003-ish. So, and then I went on to Strawman ClearCorrect about 3 years ago. So that's sort of the trajectory, degree in University of Victoria in biochem. And yeah, I'll just go through a couple slides at the end after Zach's presentation. Thank you.
Yeah, just feel free. I mean, we want this, I mean, I know we asked the questions on the chat, but please do ask them. We'll be monitoring the chat, and we want to kind of trigger your curiosity and try and answer some questions as well. We left time for it. So a little bit about the agenda. As I said, we're going to focus on 2 what we think is very important to think about when we think about why is growth, which we'll dive into, and the clinical benefits. I mean, these are the 2 main interests when you look into why you want to enter that clear aligner therapy into your practice, into your or introduce it to your patients. So before I jump in and kind of let you in a little bit of data from our own experience, just some statistics, and I'm not gonna, if you want, you can ask some questions in the chat and I'll dive in deeper, but I don't want to be a statistics discussion, but it's just high level. In North America, 16% of the population suffers from some level of malocclusion that needs to be treated. 16%. The number that is being actually treated in North America currently is less than 1%. So the opportunity and the need is massive. So when you think about whether this is something you want to introduce because maybe others are doing it already and you'll be last to enter, not at all. There's a need, there's a transition into that therapy. And I think everybody on this call, when you come in and when you start practicing dentistry in Canada, you definitely want to look into how much usage there can be to it still in Canada. We just not even scratching the surface yet. So a little bit of data. So if you look at, let's say you enter this to your practice and let's you start getting some success. If you only do 2 cases a month, your revenue is already at approximately $120,000. And the good thing about this product, the clear aligner therapy in general, it's very profitable. So you're looking at around 50%, maybe a bit less when you start up. And when you add up the number of visits that you do in the beginning because you don't have that experience yet. But still, super profitable. Even when you start up, even if you're doing low volume, just having it in the background on top of your other treatments. And once you start growing with it, and this is something we've seen, we've been growing with our clinics, with our partners in North America. As we grow, the experience level growth, the profit level does grow as well because the number of visits starts to reduce because we know how to plan the treatment better. I mean, Darren will definitely dive into it a little bit more, but we will see the efficiency level go up. And definitely when we go into those double digits per month, we are looking at a serious business opportunity that some clinics choose to actually focus on it. So let's say, just to kind of trigger your curiosity and imagination, let's say you talk to five patients a day, talk to 100 patients a month on clear aligner therapy. When you see that malocclusion level, you see that need, what do you think? What can you do? From the other perspective, and I think that's what's really interesting about what's happening to the clinics actually taking on clear aligner therapy, we can see that now a lot of the load is being taken off the dentist, and everybody in the clinic start being a part of driving revenue, driving support, being more patient-centric. So we can see that in the past, everything was kind of funneling to the doctor at the end. So everybody the hygienist, the reception, the assistant, were all kind of either helping or gatekeeping or channeling information or patient care to the doctor. With clear aligner therapy, we're looking at, for example, the hygienist. He or she can identify those cases, which means creating revenue. They can be compensated for it as well. So now they're feeling happier. The retention level, happiness level go up, and we all care about that when we start building our own practice. The hygienist can take part in scanning, or taking impressions for the clear aligner therapy. And this is something Darren will talk a little bit more, but just so you know, take an active part in the treatment. And of course, support. Clear aligner therapy is with plastic. There's no brackets, there's no metals. So we can definitely have the team help us out in taking care of emergencies because there are not much of them. And when they are, it's definitely coachable and teachable, and a program we can allocate to our team. Same apply for the reception, same apply for our own assistant, so they can start being a part of the treatment, driving that revenue with driving patient care. So we're looking at increased revenue, reduced manpower, and shared responsibilities. The practices, the clinics that we do see taking that on properly, we can see a whole different environment in the clinic. Happier, more engaged. You can see that everything is about patient experience now. And because everybody's taking an active part. So from the patient perspective, we're looking at much more care points. So not only the doctor, you don't have to wait for the doctor when they have in between appointments, maybe late in the evening when they call back, they do those follow-ups. Now the team can contribute more care points, better availability. So now they get answers. Again, you don't have to wait. And there was, I'm not going to go into it, I'm not going to share it, but just, there was a publication in the American Journal of Orthodontics that actually studied close to 200 patients in 98. So it's a while back, before even we had this therapy at the level it's today. And it showed that patients are happier when getting aligner therapy from GPs versus orthodontists. So it's kind of an interesting way to look at it because they feel more at home. It's more focused on them. So patient care is definitely important to them, and happiness level when they're going into that therapy that takes a year, sometimes 2 years, sometimes more. We'll talk about that. I mean, Darren will cover that a little bit. And we're looking at the team. Now the team is involved in the treatment. So they're doing malocclusion identification. They're doing processing and consulting. They're scanning. They're dealing with emergencies. You can already imagine, I'm sure, how it looks like from a clinic perspective. So this is kind of how clear aligner therapy can actually change everything about your clinic. We're just entering one new product. Profit, success, happiness level of patient and team, all of that really circles around one additional very interesting treatment you can add to your practice, and you can add it tomorrow. If there are any questions, I will kind of feel free to jump in. I'm not monitoring the chat box, but if there is anything, I know that Darren and Darren will help out. But now I'm going to hand it over to Darren to take over the clinical part.
Thank you, Zach. Let me get my video working here. My video working? Just the volume, right?
Let me see.
Oh, that's okay.
Yeah, I can hear you very well. That's for sure.
Okay. Okay. Okay, cool.
Yeah, I see you
Okay.
too.
Okay, thank you very much. I'll just expand on Zach's talk here. I know we're at the end of the day, at the end of the conference here, and I will keep this short and sweet. So we'll just talk a little bit about some of the clinical benefits. Zach presented the business opportunity.
What did you do to the video, Darren?
Pardon?
What did you do to the video? We were seeing you clearly. And then
Oh, here it is again. Hold on.
something happened. Perfect. Okay. One.
Okay, good. Thank you. Okay.
You understand that we do envy you for being in DC at the moment, no?
Is this a sunny day here?
Yeah. It's a bit sunny here too, but I think it's much colder here than.
It's still mild here. Yeah, it's unusual. Usually this is the rainy season, but it's we're holding off for a bit. So
it's a good day in Toronto. We can't complain today. I gotta say, you can't complain.
Yeah, it's not that bad today.
Yeah.
But I've heard BC is beautiful. I've never been there, so I wish I can do that soon.
Yes.
We all do. Yeah.
Yes. Show you around.
Perfect.
Okay, so Zach, do you want to advance my slides? Oh, okay, great. Awesome. Thanks. So I'm just going to take, again, a sort of a bird's eye view, an overview of the clinical side of aligner therapy. And I do encourage asking questions, anything you have, but I'll keep my segments sort of short. So just in the interest of time. So we'll just start right out here. Why clear aligners for you, the doctor? Obviously Zach talked about they're an attractive business opportunity. They're very accessible. There's the barrier to entry to offer clear aligners in your practice is very easy now. Maybe 10, 15 years ago, there were more hurdles to get into it, but it's very accessible and there's lots of options for you. The one interesting point that you may find interesting is the aligner market right now is about $1.2 billion American per year in the North American market, and that's expected to increase to $3.3 billion in 2025. So that's a very short period of time. And so what's basically going to happen here is there's going to be a real explosion of business and opportunity, especially for you, the dentist, and the consumer, the patient too. So it's very attractive. The education and support is second to none now. We have our own clinical education sites at Shrem and ClearCorrect, Invisalign does too, other companies, and very helpful. We have our own study club circuits. Basically, when you start out, we plug you right into a study club, so you have lots of support with your colleagues and your mentor as well. The records process, simple, right? So we accept PVS impressions, obviously, but we also accept, we're open source for scanning, meaning that we accept any scanner and any type of scan, basically an STL file. And in terms of records, just a scan, a PVS impression, a full complement of photos, and then the online form. So if there's no paper involved anymore. There's lots of flexible treatment options. So if you're doing more of a comprehensive case, we have a treatment option for that. We have a middle sort of type of treatment option called ClearCorrect 1, which is just for kind of 1 year and less treatment. So 60 to 70% of your patients will kind of fall into that. And then thirdly, we have an excellent treatment option for orthodontic relapse cases. So if a patient comes in, they've had, say, fixed appliances, and they relapse, you just want to clean them up, you just need a few aligners, we have a low cost option to do that too. So lots of options, do no harm. Clear aligner treatment therapy is very minimally invasive. It's a very simple, patients typically tolerate the process, and it's an enjoyable thing to do in the office as well. I know you're very highly trained, obviously, in other procedures, and there's a lot of serious things that happen that you need to help patients with. But when it comes to offering clear aligners, it's an enjoyable and very simple, painless process. So, and finally, it's clinically proven. It's been about, well, I guess about 20 years since Invisalign came on the scene. So 20 or 19, about 20 years now. So it's been a while. There's been a lot of studies, a lot of textbooks written on clear aligners now. Again, a lot of talk about that all over the world. And we're getting better and better in the terms of the companies providing the technology. The doctors like yourself are getting better and better at treating a wider range of malocclusions, for example, and giving those patients what they need with clinical outcomes. Next slide, Zach. Okay, and then on the patient side, I just want to touch a little bit for the patient. What are patients looking for when they come into your office? They are looking for an aesthetic orthodontic option. So they really don't, if they don't have to have metal brackets on their teeth, or even ceramic brackets, which are noticeable, they're definitely they'll go with clear aligner therapy. So it's definitely, they're looking for aesthetics. Planned progression means that they know how long their treatment approximately going to take. Is it going to take 6 months? Is it going to take a year, maybe 18 months, that type of thing. So they can plan for that. They know how many times generally they need to come into your office for visits, and you do too, which will cut down office time and office chair time. Hygiene, that's a big one. That's one of the biggest things. So not just for your staff or your hygienist cleaning, but patients love it. It's easy to keep your mouth clean, and always cleaning your aligners. We have very specific protocols for doing this. We teach you, but there's no cleaning between brackets and wires and food impacted and so forth. So no emergencies. So generally there are no emergencies. So if a composite attachment comes off the facial buccal surface of the tooth, that's not a problem. Patient comes in for their next visit, you rebond that attachment. So you don't need to call up, unlike a poking wire in the buccal tissue that needs to be clipped, a bracket that pops off, a fixed class 2 bite corrector hanging out the corner of the mouth. I've seen it all. So there's none of that. So it's really good. They're surprisingly very affordable as well. There's some great options and layaway plans that we offer for your patients. So they find it really easy to pay for their treatment. Again, it's proven therapy, which I went through, and you have access to all the top brands in the industry: Align Technology, Invisalign, what we do, Shrem and ClearCorrect, and other brands out there, ULab Systems, etc.
There's a couple of questions, Darren.
Okay.
One has to do with your marketing plan. Yulia is curious to know what is your plan for overcoming Smile Direct Club. And Aishwarya has a question about composite buttons. Won't there be composite buttons to be placed onto the teeth with clear aligners, is what she asks.
Yeah, what type of buttons are?
composite,
Okay.
raisin buttons.
Yeah. So so one thing about our product ClearCorrect is we use very few attachments on the facial surface of the teeth, and that's important. That goes back to what the patient wants aesthetic treatment. And this has to do with the trim line. I won't get into the clinical part too much, but the composite buttons are required. So if you have a rotation, say of a canine, you're trying to extrude an anterior tooth, you need a horizontal attachment on that tooth to provide a fulcrum to extrude it. The composite itself, every case comes with a template, and basically you would bond the in the attachment well or attachment template. You put your composite in there and prepare the tooth and cure it on. So we have recommendations in terms of composite materials. I do recommend translucent materials, so you can't see them at all on the teeth, which is a really nice option. There's obviously white, and you can color match them too. So, but some teeth will require attachments, but we don't have a whole bunch of attachments on the front, which patients typically don't like. In terms of marketing, yeah. So, and branding, our company's doing a lot of marketing right now. It's a lot of online marketing. We're very into social media, but you're right. Like Smile Direct Club, for example, or I believe they have $1 million or $1.5 million a month allocated toward marketing. So they're really getting the word out there. And they have, there's a segment of society that Smile Direct is good for. Again, very, very simple types of treatments that don't require attachments on the teeth. That's one thing they don't have. No, serious malocclusions, that type of thing. It's a good. Otherwise, all the rest of the cases really need to be treated in-house by a dentist, and complex cases for an orthodontic specialist for sure. So we're doing a lot of marketing, but yeah, we teach a lot of internal marketing to your team members too, to learn how to talk to patients. Any other?
Perfect. Thank you.
Thanks. Next slide.
I think there's a follow-up question. So before we move on,
okay.
Wouldn't there be composite buttons to be placed onto the teeth with clear aligner therapy? So I think that's a follow-up, or is it the same one?
No,
it's the
we
same.
addressed that.
Sorry. Same
okay.
one. Sorry. I just want to make sure. All right. Sorry. Here we go.
Okay. I'll just put a quick slide up here. I get a lot of questions. What type of cases should I do, or should I start with, that type of thing? So I thought just a quick slide on this. Good starter cases. I just recommend mild to moderate crowding spacing cases to start. And those comprise about 60 to 70% of what you'll see in your hygiene chair. So very simple kind of cases that we get excellent clinical outcomes that are also highly profitable for you, low chair time. So they tend to work out really good. Minor anterior spacing, crowding, relapse cases. Some patients come in and they do have relapse on the, say, for example, on the lower arch or a tooth sticking out. You just want to tuck that tooth in. You can even do a single arch treatment. So those are really easy starter cases. And I'm being very conservative here. Good cases after you get going with a little bit of experience, more moderate to severe anterior, spacing, crowding, up to 3 millimeters of overjet, overbite correction, that type of thing. 50%, 50-60% of overbite correction. Mild, like half step class 2, class 3 cases, those are fairly easy to correct. So those are good cases to do after you get a few under your belt. Next slide.
There's a question about comparison of the product with Invisalign.
Yeah.
So if and when, whenever you.
Sure. I'll just quickly answer that question. And I get the question every day. So the differences in Invisalign are, I'll just go through real quick here. The trim line. So the trim line of the aligners is 1.5 millimeters above the gingival zenith. And that's based on a lot of studies that we've done in the past. That will give you the maximal retention on the teeth. So doctors report with ClearCorrect that the teeth move a lot more efficiently, a lot faster too. But the other big advantage is less attachments, like I mentioned before. So we don't have all those attachments with what's called SmartTrack. Invisalign's material, it's what's called gingivally scalloped, right? So it's not above the gingival zenith. And there's a lot of attachments to compensate for that. So those are the big differences. The other big difference, our liner material does not stain and does not crack. So if patient has a lot of eating blueberries or drinking tea or turmeric, that kind of thing, their liners can stain pretty quick. So ours stay perfectly clear. And again, patients like that, again, coming back to the aesthetics of it. Drawbacks of ClearCorrect over that is we don't have precision cuts. So if you're running class 2 elastics or class 3 elastics, you have to put in your own cuts into lower molar or upper canine, for example. So we don't have that right now. But so those are kind of some of the advantages with very, very similar systems. Okay, so those are kind of went over a slide, what type of cases to start and carry on once you have a few going. When to consider a referral, I get this question a lot, so I thought a quick slide on this too. If you got a severe class 2, class 3 anteroposterior correction sagittal issue, and especially in a younger patient or a growing patient, it's probably better to refer that case out unless you have experience doing that with aligners. It's just usually protracted treatment times, longer treatment, and less profitable for you, honestly. Mixed dentition cases, I do recommend second molars fully erupted in most patients. So just kind of keep that in mind. You're going to come into mixed dentition. I've got a case that I'll just quickly show you. It has a primary tooth, but posterior crossbites, like Invisalign and ClearCorrect really expand the arch well. We don't expand technically, it's more arch development, and it does it really well, right? However, when you've got a very severe crossbite, especially a unilateral crossbite, and you need, say, interarch elastics, maybe better to send that one out. Over bites, over jets that are severe, that type of thing. You got a Bolton discrepancy, a real severe one where you're crowding in one arch or spacing in the other arch. Probably better to just pass that along to your local friendly orthodontist. So that's it. I'm just going to show just a couple of cases, and again, just open it up for questions at this point. And yeah, so this patient here. This is all published in, I believe, in Dentistry IQ. Yes, Dentistry IQ. Okay. So this is an extraction of a lower left central incisor. 27-year-old female came in, and I just put everything on the left-hand side in one big thing so everybody can read it. And so crowded, chief complaint, crowding upper and lower, 2 millimeter, 4.5 millimeter maxillary mandibular arch length deficiency, a missing lower left 3/5 second bicuspid. Primary tooth still present, small upper lateral incisors, crossbite of the lower canine, and also a midline shift 2 millimeters to the right. So this patient did not want fixed appliances on her teeth. She just wanted aligners, and you're going to see this a lot in your practices. Patients come in like, this is a typical case kind of thing. So just to expand on this, I just have before and after pictures here. This patient was treated with 16 aligners in addition to extra aligners for revision. So that's approximately, with a 2-week wear time, about 10 months of treatment. So, and this is where we brought her. So she wore their aligners for 21, 22 hours a day. And again, you want to encourage your patients to really wear their aligners as much as possible, just to take them out to eat and drink and brush and floss their teeth. And you're going to get some really nice wear time. We say 21, 22 hours a day. Some of the studies have said they're fine with 12 or 14 hours a day. But if you say 12 or 14, you're going to get 8 or 9. So you got to keep that in mind. What else in this case? The lower right 3, which is procline, what happened there was during treatment, the tooth became intruded. So the dentist that was treating this case, he had to extrude that tooth. So he interjected during treatment, put a button on the buccal surface and the lingual surface, ran an elastic over the incisal surface of the tooth, and just extruded that tooth. And it came up in about a week or two back into occlusion. So sometimes you got to use these auxiliaries, that type of thing, during clear aligners to do that. Engagers or attachments were placed on the lower incisors as well, and that's just to control the space closure, to prevent tipping into the extraction space. And the patient eventually she had an implant in here and so forth. And then the final phase, she went into retention. So a few weeks of thermoformed retainer, and then she actually came back and she got a fixed lingual retainer on the bottom too. So pretty typical case, but I thought it turned out really well. Yeah. And I have one more case I put up. Thanks, Zach. Okay, so this is interesting. This was I think it was just published like in October or November, during COVID, right? So this patient came in, and here she presented with to fix her crooked tooth. That was her chief complaint. That's her upper left lateral incisor, and she had specific goals. She had won braces, all that type of thing. So this is a pretty simple case, and I just wrote a couple notes here. Yeah, what happened here was during treatment, her upper left lateral incisor was not tracking properly. So what the dentist again needed to do, and they did a revision on this, was IPR, so interproximal reduction, mesial and distal to that canine, just to open up the space, right? And this is really important for aligners, that anytime you're trying to intrude or extrude or rotate a tooth, it's important that you have enough space interproximally on either side for that to happen. So again, just a little bit of IPR, I think at 0.1 or 0.2 millimeters per side, and then allowed that rotation to take place and to tuck in, and it worked out. It worked out really well. The patient also used, just a note on this, because they used a Propel device as well. Propel V Pro 5. Propel, that's just a wafer that the patient bites on. It's brand new technology in orthodontics. If you're ever interested in this, I can get you in touch with the right people. But what it does is it increases bone remodeling and helps seat the aligners a lot better. So the patient also had micro-osteoperforation just to help with the bone remodeling in this case too. So it went out pretty quickly. So I'll just leave it at that. I know we're at the end of the conference, end of the day here, and if you have any questions, please ask. Yeah.
I think there's one.
Thank
Let's
you.
see.
Definitely an interesting aspect, and for sure very new for most people, and the opportunity that Zach declined was, if I remember correctly, 16% of orthodontics that requires treatment, and less than 1% being treated. That's a huge gap, and I don't think anyone who has concerns about the viability of using of aligner therapy should, or orthodontics for that matter, I think that's a very convincing answer.
It's not even taking into consideration the aesthetic element, just not even patients that come in and say, I want to look pretty. It's just a malocclusion level within the population in North America. So it's
Lubna is a former trainee of SIDE and is now a practicing dentist, and she's asking if you're offering any training or courses, Zach.
Quite a lot. We are known as a company, as the Straumann Group, to position education first in any of our solutions, products, therapies. So rest assured, when you need it,
especially in collaboration with SIDE, is what she means.
And there's a reason we're here today. This is something we definitely value first, and you're right. But we have a lot of programs. Some of them are just accessible. You can look us up today, and you can find many learning plans accessible to you as a dentist as immediately virtually. And we have a lot of study clubs running all across the country with leading practitioners, and maybe Darren even can say more about it, because it's definitely one of our focal points.
Yeah, typically, if you ever want to get started, just get in touch with your representative. We come in, we have a specific protocol, learning protocol to help you. We have online courses as well. We have a whole clinical education site. You can go in there, and you can peruse that. There's a lot of resources to help get started. And then basically after that, we'll identify some cases, start getting going. We'll plug you into a study club. And so you have a lot of support, from local dentists and also from our mentors, which are typically, our mentors are typically orthodontists. So they do, one of them in Western Canada, his whole practice is limited to orthodontics, or limited to ClearCorrect. So that's including phase 1 cases too. So he's very, very experienced. So he helps a lot of dentists, and it's just makes it easier, right? And then obviously ongoing support as well.
Just something from the culinary therapy can allow you a lot of virtual support from experts. So you can basically control your progression in education as you tap into experts helping you plan the treatment. So because it's the whole clear therapy industry is heavy on technology, so it's very tech savvy. So you'll be able to kind of tap into other experts for a fee, but you can build it into your business plan, and being able to get that top-notch therapy and treatment to your patients without ever having to refer them out, all thanks to technology and this type of therapy. So just food for thought. I mean,
thank you, guys. I think this has been a highly enriching 1.5 day for everyone, and I'd just like to request everyone to please use the links that I just shared to fill in the feedback forms and post and share reviews of your experience. And definitely whatever we've discussed over these 2 days is actually the tip of the iceberg, and everything moving on into the next year, we will be expanding education, learning, the educational and learning experience on those subjects, offering more depth, more information, more orientation, and which will eventually lead to a more meaningful knowledge and skill gain that you can apply in practical. So that's what the plan is as of now. And if you liked the tip of the iceberg, I'm sure you will enjoy the rest of the iceberg as much when it comes to you. So with that reminder of writing us a review if you enjoyed the program, leaving us a survey response, which is also equally important. I wish to thank you all for your participation, and wish you all the best. We do look forward to seeing you again in our other programs, which we will continue to offer. A huge thanks to all our speakers who took out the time to speak to the audiences and enrich their share their enriched experience and time with the new dentists. And we hope that all of this will help you seamlessly integrate into Canadian dentistry. So until next time, I wish to say goodbye, and we look forward to seeing you again. You are welcome, Yulia. Thank you. Thank you, Aishwarya. Please, if you value whatever we offered, please make sure that you give us the feedback in the form and write us a review if you really enjoyed it, if you liked it. We would really appreciate. The only token of appreciation we want is a review and the feedback form. That is all we ask for. We hope this was a valuable usage of your time. Okay, Bilal. Yes. Okay. It is here. Jayant, thank you for joining us. Always a pleasure. Alia, Jasweeble, Lubna, Isa, Arlene, Valerie, Sangeeta, Jocelyn, Mishti, Yulia, Sunil Kumar, Diana, Prashank, Lauren, Aniket, Monica, Sabah, Rukaya, Bilal, everyone. Thank you. And thank you, Zach. Thank you, Darren. And a big thank you to all the speakers. Majid Razai, sorry, I missed your name. Valeria, you're welcome. Just one request, the survey and a review, if you feel like it. That's all we ask for. Thank you.